Hello, Alin Odor. How
Hello,
are you?
Ricardo. Thank you, Ricardo. It's a
So,
pleasure to see you.
first of all, let me thank you very much for having us in this 40 Talks. I'm not sure if you know, but 40 Talks were launched last year during the pandemic. And this was a very good moment for sharing 40 dentistry with the world. So let's start with this and tell me, who is Alin Odor?
Wow. Good question. The very first one, it's a good question.
We start with a good one, always.
Yeah. Alin Odor is a dentist, a periodontist, and a laser in dentistry specialist. I graduated about 10 years ago here in my hometown, Constanta, Romania, where I practice and live. And also, I finished a PhD right after graduation. I had enrolled to the PhD program here also in Constanta. During my PhD, I managed to research and develop two laser periodontal protocols, laser-assisted periodontal protocols. So I am focused mainly on hard and soft tissue regeneration, full mouth rehabilitation, on implants also, and I think this is me, right?
So I can call you from now on laser guy.
Yeah.
Or should I call you MODJAW guy?
Better MODJAW.
There you go. So for how long are you a 40 and a MODJAW user?
I will always remember the 3rd of October. That date.
And why is that?
Because that date reminds me that your first visit to Romania, first visit to our country in Constanța. So
it was a great day.
Yeah, for sure. So it is kind of, we are in April, something like 7 months.
Yeah.
More or less.
And how first let me know, what is 40 dentistry for you? What was it back then when you decided to buy MODJAW? What was the 4D concept for you?
Let me put it this way. It's like the sixth sense of a human being, or or a dentist. It is that kind of dimension when you can see, feel, and plan everything. But let me put it this way, because it's that kind of feeling that Moses had when he split the Red Sea in two and creating a path in order to see the bottom layers of, let me put it this way, in dentistry. For us, we can make slices and see between them with this kind of equipment. So
how is it the integration of the device at your clinic with your workflow? So by doing all those stuff that you were doing with laser and protocols and surgery protocols, full mouth rehabs, how did MODJAW entered in that protocol, in that workflow?
So first time I saw your four talk dentistry, and right after that I started to integrate in my mind everything. And let me put it this way, okay, this is a great equipment. How can improve my practice, my workflow for every case? So, you know, I'm a periodontist, and I'm not a specialist in occlusal things and problems. And I thought that maybe this equipment will compensate my lack of knowledge
on that specific occlusion problem you were having.
Yes, that occlusal field of dentistry, because I'm a surgeon. I like to do the foundations, but in the last thing, the occlusion is the essential part. Even if you are trying to build the bone, soft tissue, putting there a lot of implants, everything will resume to the occlusal parts, the motion of the jaws. So the integration for me, it was like, okay, this is a new device, new technique, and maybe it will compensate my lack.
Your
Let
other
me,
techniques, your workflow,
yeah,
you
my
know,
workflow.
at
Yeah,
the end is about workflow, exactly. So
yeah.
so and are you using now module like in a daily basis? Do you have some case that you want to show or share with us?
Yeah, for sure. Every new patient that comes for a full mouth rehabilitation will undergo this kind of determination, the 4D determination, the MODJAW movement of the jaw. We take the patient as it is, as it's presented to our clinic, and it's like a baseline examination. The
Hmm.
baseline examination of the patient condition, and from that moment we will start to plan everything, because we encountered a lot of problems during in the past. Let me put it in the past,
Yeah,
because we didn't have this kind of device
technology.
that records everything.
You are feeling now that actually you are able to digitalize your patients.
Yes, this is.
So show us this
Let
case.
Yeah, let me put this small video here, because
Oh.
this is I managed to integrate also the CBCT scans of the patient, and also the intraoral scans, and all of this in one equipment, the MODJAW. And the biggest thing that every doctor has a problem with the RC central relation determination. And this is the equipment that shows you in real time that the condyles are seated in the cavity. And
Exactly.
look at this motion.
Yeah.
I know that you are familiar with this, but for our viewers, uh, it helps me to have a better view upon the patient, because everybody knows that centric relation cannot be seen with your own eyes, not in this case, but still you have a better idea where everything is. Unless you are using special devices, special surgical devices that enters the
Yeah.
TMJ, and that is
Yeah.
invasive. So this is the minimally invasive thing that you can get upon the centric relation. So yes, this is the best image. Let me put it
Great.
this way.
Great.
It's the
Thank you
best
for that,
image.
Alan. Thank you for that. And tell me one thing. How are you enhancing your communication with the lab? I'm sure that module had a very special and important role on that how do you say on that relation, with you and your lab technician. So tell me more about it.
Let
Thank
me
you.
see just a moment. Yeah, the lab that is doing our prosthesis. First time that they heard about the MODJAW, they was okay. Let us see how can we integrate your movements, your clinical part in our lab part. So this is the patient. Yeah, the chief complaint was the aesthetics, and she wanted a brighter smile. Um and I
Like
will
a
not go.
Hollywood smile. She was looking for a Hollywood smile.
Yes, the Hollywood smile, smile in a box, and so on.
So show us the result.
Yeah, so this is the baseline, and the first thing after provisionals, because I didn't have the MODJAW back then, and
Mhm.
right after provisionals, I placed my tiara and the butterfly on the patient and start recording the jaw movements. So this is the movements that I recorded during our treatment plan. And right after the final prosthetics, I send these movements to my lab and ask them, okay, let's integrate in Exocad this movement. So first time the lab was okay, we do not know how to import this, and I just called Ricardo and asked him, and the whole staff really helped me integrate this movement in Exocad. And right after that, the lab technicians was okay, we have the movement, and now we can start with the anatomy, the design of the prosthetics. So I had here the image, the overview of the future uh, outcome. And right after, this was the first step, right after the prosthetics. And I saw that I had some contacts that I should remove, and I removed them. But for a full mouth rehabilitation, to have this kind of
Image. You can
image,
say image.
yes, the image and everything is narrowed. And me as a clinician, I do not want to spend a lot of time adapting occlusal points and so on and biting. This was everything shrinked for my workflow. And this was the first case that my lab performed with the MODJAW, and it was an improvement.
You are almost make me cry. I'm so proud of you, Alan. And this is the result of not only that friendship that we have, but also about what you have learned and what I shared with you.
You opened my mind in 4D dentistry. So, as I mentioned before, I'm not a specialist in occlusal
Yeah,
diseases and so on. So, for me, as a periodontist, which is very important to have a good occlusion, a good adaptability
adaptation.
of
Yeah.
the prosthetics. So, for me, it is perfect.
And let me ask you one more thing.
Please.
Uh, uh, so when we're talking about the number of patients or the number of cases that you are doing nowadays, do you feel like Mojo is helping you on the number or on the results, on the objectives that you were seeking when you decided to buy the module?
Yeah, for sure. Because the first patient that encounters Mojo was okay. Wow, this is awesome to really see my movements in real life, real time. So it was wow. And you know how it is. That patient also has a lot of friends, and a lot of friends that they are possible patients. So okay. Um, I don't know if my number of patients increased because
But yeah,
I'm fully booked already.
yes,
So, but every patient that has mojo determination and speak to the other patient that he knows it, that patient also will ask me, but that guy had the
improvement.
mojo. I want also a mojo. I want
Yeah.
to see this new technology, because everybody knows that technology in this century it is skyrocketing. So
Wow.
this is the business project, the business
This is
model.
the business model. This is the
Yeah,
business model.
this is the
This is
business
the business
model.
model. Yeah. I
Yeah,
totally
because
understand you.
in the end, the patient, they do not understand the path between A to B. They really understand the B part, the
Yeah.
last part, and they want to see this kind of results. Yeah, and if they ask me, I want this kind of full mouth rehabilitation in order to succeed in this treatment plan. I will tell them we should the first thing we should do a mojo determination,
But
pictures, CBCTs, and so on. And
yeah. Bro, let me tell you one thing. Every time I look at this picture, I see a top world zone. Myself as a dental technician, I respect so much, all the guys that are working and taking the more advantages of the digital technologies they have on their ends. And by seeing this, I see, wow, this is a world class, man. So
Thank you.
congrats again. Thank you very much for sharing with us this kind of content. Thank you for being a module.
Thank you, Ricardo, first for your invitation for your 4D talks. Hope to see you soon, right?
We will, for sure. See you soon, bro. Thank you very much.
Bye.
Bye-bye. Thank you.